Well, good afternoon, everyone. Thanks for joining us this Christmas week. I want to start out by just wishing you all a blessed Christmas. We will not be having presser update next week as a result of kind of the holiday. So we'll reconvene. I think that'll be January 4. I think will be the next time. So 2 weeks from today. Wanted to start out because it's Christmas. I want to just thank a few people, a few notes of appreciation. One is a group we haven't talked about a lot recently, but I was speaking with someone who asked me how many school districts of our size have not had to go to remote learning during this semester. And you know what? I bet there's very few school districts the size of the ones here in Sioux Falls that have been in school the entire semester. And that's very laudable. And so we should thank our teachers and our educators for the great work that they've done to make sure that that's happened. Obviously thanking our healthcare workers in this holiday week and the work that they do. Our first responders, I got some data the other day that right around 33% of all of our calls that are fire rescue men and women are going on are respiratory related calls right now, so about a third of all those calls. And so they're putting themselves in harm's way every day. And then lastly, just a big thanks to our residents for the great work you're doing right now to ensure that the numbers that we're going to see here in a minute stay where they're at. So that's very noticed and very, very appreciated. Over the last 14 days, not only has our positivity rate crept down a little bit, but our cases have continued to decline, the new daily cases in the Sioux Falls MSA. The active cases have plateaued a little bit the last week or so, but still you can see as of today right around that 2,700 mark, down from about that 5,000 mark just 2 weeks ago. So really great drop off in the number of active cases that we've seen as our healthcare partners can attest. And that has seen a direct correlation to what we've seen in hospitalizations. These numbers have correlated to what I'll call a little bit of a sigh of relief or some breathing room that it's allowed our healthcare partners to be able to take. Still high numbers because remember this is just COVID only and they're still very busy in a lot of other facets of their organizations. But seeing us down in the teens and in 120s is really great information. So a lot of people want to know about vaccination and vaccination schedules, how that rollout has gone. And so with that, I'm going to turn it over to our healthcare partners to talk about that piece of our COVID response. And I believe Dr. Elliott from Vera is going to kick that off. So, Dr. Elliott.
Thank you, Mayor. Good afternoon, everyone. As the Mayor said, good news in terms of the local numbers in recent days, recent weeks. I wanted to share with you just a little bit of where we're at relative to national numbers. I think these are telling as well. As much as we can be excited that we're not seeing the exponential growth in new cases, new hospitalizations that we saw in November, there still is reason to be cautious and to stay vigilant with all of the mitigation strategies. Out of the 50 states here in the United States, South Dakota is the second highest percent positive tests in the last 7 days. About 39% of our tests are positive. Idaho is the only state in the country with a higher percent positivity rate. We also have the second lowest number of tests per 100,000 people. What that should tell us is we need to do more tests. If our State Department of Health can do more tests, if we can contact trace better, we're more likely to identify when hotspots flare up. And the sooner that we can identify those folks, the sooner we can help educate them on the importance of quarantining and slowing the spread. In terms of cases, South Dakota is the second highest state in the country in terms of total reported cases per 100,000. Here in South Dakota, our rate per 100,000 is about double what it is across the rest of the country. In terms of hospitalizations, South Dakota is the 14th highest state in terms of number of patients hospitalized per 100,000. So even though we're better, even though the numbers look significantly better than what they did for our hospitals at the end of November, first part of December, we still have a long way to go. And as the mayor said, we're very busy just with routine things that we're always busy with in December. So the additional COVID patients on top of it continue to stretch our physicians, nurses, pharmacists, techs, the whole lot of them that are just continuing to come to work every day and work really diligently. In terms of mortality, in the last 7 days, South Dakota has had the highest daily reported death rates per 100,000 population in the United States. Our rate in South Dakota is 12.4 people per 100,000. The United States, 5.5 per 100,000. We're getting better. The numbers show some optimism, but still much need for us to continue our mitigation strategies. There have been a lot of talks about the masks. Nobody likes wearing masks. Everybody's getting tired of it. But there is data that says that it works. I'll lift up a county just north of us, Brookings County. You know, in September, that county put forward a mask mandate. Since that time, that county, per population, has been one of the lowest in not just the state, but in the entire region in terms of number of new cases. We were so worried about an uptick that might occur after the Thanksgiving break, and the mayor and the city council were able to get a mask mandate passed here, and thankfully, knock on wood, we have not seen that uptick in cases post-Thanksgiving. That's been a huge relief. Some additional good news. As the mayor alluded to, we did receive our first shipment of COVID vaccine last week. Avera McKinnon received right around 3,000 doses from Pfizer, and in about a 3-day time span, we used every last dose of that vaccine. Our frontline healthcare workers stood in line, happily rolled their sleeves up. We got them vaccinated as quickly, as efficiently as possible. We monitored them for the 15 minutes like we were supposed to. We had no serious side effects at all. What we've been telling our employees is what we've been hearing from the safety and efficacy data from the FDA and the CDC. Yep, you can expect a little soreness in your arm. Yep, you might have a little low-grade fever. All of those things are coming to fruition. But those are minor effects of a very effective vaccine. In fact, arguably the most effective vaccine that we have ever seen. We are expecting the Moderna COVID vaccine to arrive on our loading docks hopefully tomorrow morning. We've already scheduled clinics for Wednesday and Thursday of this week. We will take Friday off from the vaccination plan because of Christmas, but then we'll resume right again over the weekend and go into next week and continue to do that as long as we can until all of those vaccines are distributed as well. The Moderna vaccine is going to look a little different for us than the Pfizer vaccine in that it is a little easier to transport, doesn't have quite the same restrictions on temperature control. So we're going to ship a majority of our Moderna vaccine to our regional sites and our critical access hospitals. And we hope that by the very beginning of next week, we will have all the healthcare workers in those areas covered. Then we will come back and complete the vaccination of the healthcare workers here in Sioux Falls while simultaneously taking care of the long-term care residents in all of our regions. We hope to be able to have that completed in the beginning to middle of January, and then we will take next steps as directed by the CDC, the FDA, and the State Department of Health. You've heard us talk a little bit about monoclonal antibodies. Eli Lilly, Regeneron, monoclonal antibodies, it's a medication that we can give to folks right after they've been diagnosed with COVID, before they have severe symptoms. And we know if we can give this medication to folks early, we can help prevent severe illness, can help keep folks out of the hospital. We had folks from the Center for Medicare and Medicaid Services, CMS, and the Center for Disease Control, the CDC, reach out to us to ask us how it was that we were so efficiently distributing these monoclonal antibodies. They wanted to lift this up and see if they could give other folks some tips and tricks on how to distribute this medication. We were very fortunate. We were doing research trials with the Regeneron monoclonal antibody even before it received its EUA, and continue to very efficiently give these to folks. You know, the thought is maybe that 1 out of every 10 people that get this monoclonal antibody may not need to be put in the hospital. If we can reduce the number of hospitalizations from COVID by even 10%, that makes a significant difference in the healthcare burden. So we're very excited about this, thrilled that we've been able to partner with Eli Lilly, Regeneron, and others to get this done. I'd also like to lift up our Avera at Home program and our COVID hotline. They're still daily contacting over 1,000 people with COVID to help make sure they're safe, help maintain their health while at home. Again, imagine if 10% of those folks needed to be in the hospital, how different the landscape might look today. So my sincere thank you to all the volunteers, the nurses, the physicians that are helping to oversee these efforts. It's made a huge difference. As we go into the holidays, as we begin to look at celebrating Christmas, I just want all of you to remember it's so important to continue to wear your masks, continue to socially distance, good hand hygiene, isolate if you're symptomatic at all. Many counties in this part of our region are still in the red category, meaning they have a significant number of new cases. This puts us at risk. Anything we can do to help mitigate that risk within reason is very appropriate. This is such a wonderful time of year. It's so important to be with friends and families, but it's so important for us to be safe too. There is an end at sight. It's going to come. We're going to get people vaccinated. We're going to make it through this. So now's not a time to let your guard down, but it's a time to continue to stay safe and to stay vigilant. I do want to say thank you to all of my colleagues in healthcare, in the Sioux Falls, around the state, around the country. 2020 sure didn't turn out to be what any of us imagined it would be when we were celebrating the holiday season last year. But with tremendous courage and tremendous dedication, I think healthcare can be very proud of the number of people we've taken care of the compassion and the skill that we've brought forward. So sincerely thank you to each and every one of you for all you're doing. And thanks to all of you that don't work in healthcare but are continuing to wear your masks, continuing to be careful. That's important too. And you have individually and collectively made a difference. I think that's all I have for today. I will turn it over to my colleague, Dr. Wilde, for comments this time.
Thanks, Dr. Elliott and Mayor, and good afternoon. So at Sanford, we're, like the graph showed, really holding steady with our number of inpatients in that 45 to 60 range, with probably about 30 to 40 patients in addition to that who came in with COVID but have required longer stays, just really due to illnesses that go along with it and complications that we can run into. We still see, unfortunately, the illness really having tragic consequences, not only directly or indirectly, and continue to be very attentive and really dedicated to caring for anyone that comes to us. Dr. Elliott alluded to or discussed the monoclonal antibodies and the vaccine, and I'll just make a couple of comments. We too are providing the monoclonal antibody under the emergency use authorization. preliminary data, we are seeing a reduction in hospitalizations in those that receive it, and really encourage that if it is offered to you to take advantage of that treatment that is proving to be very safe and potentially effective as well for preventing hospitalizations. And we are doing that not only in Sioux Falls, but throughout the Sanford network as well. We started vaccinating upon receipt of the Pfizer vaccine last Tuesday, and have been giving doses as many as 600 a day, and using the supply of the Pfizer vaccine that were given. That has been well received. It's interesting as you walk through our vaccination area, the energy, the optimism, things we haven't been accustomed to seeing in 2020. It's amazing how, as we provide the vaccine, not only to folks that work at Sanford, but folks that work in healthcare in the city or around the area, the appreciation and the energy that something like a vaccine can generate. We anticipate the Moderna vaccine tomorrow. We'll start giving that tomorrow afternoon and go through the holiday, probably a little time for Christmas, but otherwise we're going to try to get that to as many people as rapidly as we can. We will be giving more of that in our network facilities as well, like Dr. Elliott alluded to, due to its ease, a little easier to transport. I would point out, too, that as you do receive vaccination, the Centers for Disease Control does track and also ask you about symptoms on a daily basis. You receive a text message, and it's just real quick survey information. So they really are paying a lot of attention. We do, Avera does, as does the state and federal government, as to the effects of the vaccine, and would echo that it's very consistent right now in what we saw with the studies that were released. Dr. Elliott alluded to testing, and in regard to testing, what we felt was very important with Sanford is really controlling what we can control and prioritizing the folks that we serve. And so we are buying some newer generation of the antigen testing machines. We anticipate those to be available in the first 1 to 2 weeks of January. These machines do have a rapid turnaround time and as high as a 98% sensitivity if someone does present with symptoms, that we, within about 15 minutes, will have great accuracy to determine if they have COVID or not. We look forward to getting those not only in our network facilities, but in Sioux Falls clinics as well. And really what this leads to is hopefully finishing the pandemic. It's amazing to sit here and talk about, 9 months have gone by. It seems like 10 lifetimes, but it also has gone quick. And again, it's caused a lot of issues, obviously. However, between caring for yourself, which again, people have done, I think, a very nice job, and keep up that energy, thank you. In regard to getting the antibody infusion if offered, in regard to getting vaccinated when offered, I think there's hope to concluding this pandemic in the near future. And lastly, I would just end with thank you for everything everyone has done. I appreciate my colleagues in the city, the state, the federal government, in addition to Avera and Monument as well. People have worked very hard, but most importantly, the patients that we work with have worked really hard, and the staff that has cared for them. Wishing everyone a Merry Christmas, Happy Holidays, and hopefully a better 2021. So thank you.
All right. And thank you to these two guys. They give up every Monday to come here and keep the public updated, and they've been great allies and partners. In addition to this, we're on the phone with them several times a week, 2 regular update calls that we have every Monday and Thursday morning to keep in the know of what's going on with their systems. So appreciate you guys. Questions that you might have today for myself or either Dr. Wilde or Elliott?
I'd like to focus on the positivity rates. They're well above the 5% guidelines that we're looking at. And both of you guys said that we need more testing probably. How do we do that? How do we increase the testing?
Might let Dr. Wilde speak to that?
Yeah, like I just talked about, We actually, first off, and so the question was the focus on the testing, the positivity rate, looking at a goal of, ideally would be around that 5%. We're seeing much higher numbers from a positivity rate, and then things we can do about increasing testing. The testing we're currently doing at Sanford, we've actually seen those positivity rate going down. We're not at 5%, but they have been going down, which is why I'm really thanking the folks that are out there for putting the energy toward taking care of themselves, protecting themselves. And then it's really about investing and prioritizing the things that we think can help finish the pandemic, and testing is one of those. And that's why now that we have a bit more confidence in what's called the antigen testing versus the PCR testing that we have been doing, we have a little more confidence in the antigen testing and are making an investment in that, because testing is part of the way, in addition to all the other things we've talked about, regard to keeping people safe and hopefully bringing this pandemic to conclusion.
It looks like testing is down. How do you increase that?
You need more machines, more availability, but also, certainly encouraging, like Dr. Elliott did, like I did, really be thoughtful. If you are having symptoms, get tested. And could there be, now I'm speculating, but could there be people right now that feel okay but maybe have some upper respiratory symptoms that simply aren't getting tested? That is entirely possible, and I would encourage people to work with their healthcare providers in that regard.
It's a good question about how do we increase testing. I've had a chance to work with Director Franken since the very beginning of this, and it was a question she was asking us on day one. As a health system, Sanford, Avera, Monument, our charge is to take care of patients, right? And so if you're symptomatic, we're going to figure out how to get you tested. What we're really looking at, I think, the next level of testing is more from an epidemiologic standpoint, and that we're going to need help from local, state, federal governments to make sure we've got testing capability, testing supplies, a number of folks available to do contact tracing. Tests in and of themselves are only so effective, but if you can do appropriate contact tracing and education, the whole gamut of it is what's going to be most effective. Please remember, estimates right now are that 50% of the transmission of this virus occurs from asymptomatic carriers. So 50% of the time, you or I or anyone who's gotten COVID got it from someone who didn't have any symptoms but was contagious and able to spread it. There's no screening that's going to stop that. It's got to have to come through testing and then appropriate isolation and quarantining after that.
How about testing for antibodies? Should we see more of that?
Yeah, Dr. Wilde, I think, said it nicely. Initially we were held to kind of the gold standard, the PCR testing, and we had to be. As healthcare systems, we needed to be using a test that was as sensitive and specific as possible. The newer generation antibody tests, antigen tests, have shown to be sensitive and specific. At Avera, we are internally evaluating a product from a company called Lumiere. Lumiere DX is their platform, and have started to use that at our sample collection center. And yes, the turnaround time for that is so much better. It gives us an additional avenue to be able to do tests to get results to people in a quicker fashion. That also will help.
Thanks. And your question was around the antibody testing, and the antibody testing is, if you have antibodies, we have a good chance of picking them up when we do test for them. However, we're not sure yet what that means. We assume, but it's not proven, and that's kind of what we've been dealing with a lot of times through this pandemic. But we would assume you've had COVID, And we would assume you have some immunity going forward, but that is not proven. Therefore, we're not making recommendations around that. So I don't think antibody testing is real helpful yet in regard to this pandemic and the mitigation of the pandemic, but there definitely will be more to come on that as well.
Any other questions this afternoon for either these guys or myself?
You talked a little bit about some of the actions taken by City Council last week, updated mask mandate, the COVID action plan going back into or being readopted.
Yeah, so the council did pass an extension of the mask ordinance, which quite honestly has gone over pretty well in our community. I think the compliance has been pretty good about what we expected that to be. The council also passed a resolution that, and again, a resolution is a non-binding piece of legislation, I guess, if you will, that really reinforces the entire gamut of what we need to see in the community right now outside of just masking, including supporting a lot of our small businesses right now during the holiday season. So at the rate of which we're seeing the vaccines and the rollout of the vaccines, the council will have a chance to potentially extend that mask mandate come March. But like I said, at the rate that things are progressing with vaccinations, it could be that that will not be extended. That's still a couple months away, but we'll see how that goes. So.
What would you want to tell folks as we get ready to gather for Christmas? It looks like we avoided a surge after Thanksgiving. We let our guard down now, or are we looking at a possibility of another surge?
I think we're still in the height of COVID right now, and it's been interesting to see how the surges kind of started on the coast, and then they kind of came into the heartland, and then they echoed back out, and now the coast are. It's just such a weird virus to try and figure out. For instance, I can't figure out why we're coming down. Okay? I don't know why that is. I wish I knew. I wish there was some crazy rationale for it. And that's what we're going to be studying for many years to figure out what sort of density of population and so forth has an effect on these sorts of numbers. I guess my message to people is it is Christmas. You need to celebrate Christmas. You need to celebrate safely and responsibly for what that looks like with your families. Okay, I went and visited my grandma Saturday night in her home. Had a plexiglass visit, and that's what Christmas is going to. It's the first Christmas in many, 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 many years I have not had pig in the blankets with my grandma, and that's just how it's going to be this year. And so it's a one-year sacrifice that we're making to ensure she's safe, our families are safe, and so that would be my message to people: is celebrate a little different, think about others, and next year I think we'll be in a much better spot to have those pig in the blankets.